Headache is a very common symptom in children, and almost all children have witnessed headache by the time they reach their adolescence. However, the causes of headache can vary from harmless conditions such as tension headache to more worrying conditions such as brain tumors. Therefore, it is very important that your child is seen by a doctor if they have a headache that lasts beyond 2 weeks or if their headaches get progressively worsened. Let us understand some important information about various headaches that present in children and how they can be treated successfully. A headache is pain or discomfort in the head or face area. Headaches can be single or recurrent in nature, and they can be localized to one or more areas of the head and face. What causes headache is not completely understood to date. It is thought that many headaches are the result of tight muscles and dilated or expanded blood vessels within the head. Although migraine headaches are previously thought to be due to dilated blood vessels in the brain, newer theories suggest that changes in brain chemicals or electrical signaling may also be involved. Lack of sleep or poor sleep quality are often the cause of chronic headaches. Occasionally, there is an actual problem in the brain, such as a tumor, although this is relatively rare. The way a child exhibits a headache may be related to many factors, like genetics, hormones, stress, diet, medications, and sometimes simply to dehydration. Recurrent headaches of any type can cause social issues and other problems like school problems, behavioral problems, and psychological issues like depression. There are many different ways that you can classify your child's headache. One common way is to categorize headache as primary headaches and secondary headaches. Primary headaches are when there is no clear identifiable etiology is present, and you call secondary headaches when there is a specific underlying etiology for your child's headache. Primary headaches are usually caused by tight muscles, dilated blood vessels, alterations in communication between parts of the nervous system, or inflammation of the structures in the brain. And they are usually not linked to another medical condition. Two main types of primary headaches include migraine and tension headaches. Migraines may start in early childhood. It is estimated that nearly 20% of teenagers experience migraine headaches. The average age of onset is 7 years of age for boys and about 10 years of age for girls. There is often a family history of migraines. Some females may have migraines that correlate with their menstrual periods. While every child may experience symptoms differently, the most common symptoms of a migraine include sensitivity to light and sound, throbbing headache, vomiting, tummy pain or sense of flashing lights, a change in vision, or sometimes feeling of funny smells. Tension headaches are the most common type of headache seen in children, especially among the teenagers. Stress, mental and emotional conflicts are often the factors that results in tension headaches. Secondary headaches occur due to an underlying cause that may vary from a simple viral infection to a brain tumor that sometimes carry a poor prognosis. These headaches are much rarer compared to migraine and tension type headaches. Common secondary headaches include those that occur secondary to ear, nose and throat infections, difficulties with vision, and sometimes psychological stressors. Symptoms that may suggest a serious underlying cause for your child's headache may include progressively worsening severe headache, a child is awakened by the pain of a headache that starts very early in the morning and is relieved by vomiting, or pain that is made worse by strain like coughing and sneeze, associated with change in vision, co-occurrence of seizures, or weakness in arms and legs, and sometimes balance problems. The full extent of your child's headache may not be completely understood initially, and sometimes your child may need comprehensive medical evaluation and diagnostic testing. The diagnosis of a headache is made with careful history and physical examination and diagnostic testing. During examination, the doctor obtains a complete medical history of the child as well as the child's family. Most single headaches that resolve with no health effect on the child do not need any additional investigations. However, if the headache is chronic, progressive, or associated with any red flags, then your doctor is likely to recommend either CT or MRI scan of the brain to rule out a structural problem in the brain, such as a brain tumor. The need for other investigations depend on the clinical presentation and the likely diagnosis in your child. Specific treatment for your child's headache will be determined by your child's doctor based on your child's age, medical history, and the overall health. The ultimate goal of treatment is to stop the headache from occurring. Medical management relies on the proper identification of the type of headache, and it may include rest in a quiet, dark environment or use of medications as recommended by your child's doctor. Stress management is very effective in children who are having stressful lifestyles. It is also important to avoid known trigger factors for headache like certain foods and beverages, lack of sleep, and fasting. Your child's doctor may also prescribe medications for the headache, especially if they have a clear underlying cause for the headache or when migraine is suspected. Some headaches may require immediate medical attention, including hospitalization for observation, diagnostic testing, or sometimes even surgery. The treatment is individualized depending on the extent of the underlying condition that is causing your child's headache. The extent of child's recovery is again individualized depending on the type of headache and other medical problems that may be present in your child.